Hi, Monty Judd here with Rejuvenate Health, and I have Dr. Moshe Dekel with me from Rejuvenate Health on Hilton Head Island. We have talked about menopause in a past podcast. We want to talk to the men now, Dr. Dekel.
It's about time, don't you think?
Yes. In a previous podcast, you had mentioned that men start losing testosterone at age 25. That's a terrible statistic. You mean we're getting worse as women get better?
That's part of it. But kidding aside, the facts are the facts. It's from 25 and on, we lose about 1 to 2% per year. So by the time we're 50 or 60, we can be working on 20, 30% what we had when we were 20 years old. The issue is that nobody takes the levels at that age, and they come to us later on in life, and we take a test, and now we have a normal of testosterone between 200 and 1100. So I see you smiling and laughing and says, how can it be normal between 200 and 1100? That's exactly the point. Because I see patients in our clinic that actually have a 201. That's normal, right? But they're totally dysfunctional, totally unhappy, but their conventional doctor would not consider supplementing with testosterone. And that is the problem.
Well, what other symptoms, are the men going to erectile dysfunction drugs, Cialis, Viagra, or what other symptoms do they have besides that?
Okay. Excellent question. In fact, the number one reason for men's depression over the age of 50 is low testosterone. Okay, nobody's diagnosing it, because if a man over 50 comes to a doctor and says, I'm depressed, no big deal. Choose your poison. What would you like? But kidding aside, muscle loss, okay, men complain, they say, I'm going to the gym, I cannot be productive, okay, and I'm working out, I'm losing muscle. What the hell is going on? Obviously depression. It's just testosterone has receptors for it in the brain in a high quantity in men. Women have it too, but in much lesser quantity, obviously, for obvious reason. So if men does not have normal testosterone, they're going to be depressed. So it's really how they look at life, how they start the day. Obviously, libido is a major issue, and also obviously erectile dysfunction. So all of that is kind of encapsulating what's happening as your testosterone goes down.
Well, how do you get the testosterone? There are probably 100, if not 1,000 different supplements that say, here's testosterone, take it. But as in women, they need the bioidentical hormones to replace their hormones. Is there such a thing for men?
Yeah. Well, I'm happy you mentioned the supplementation, because there are some supplements that actually stimulate the testes to make more testosterone. And for some men, it will work, and they're absolutely fine. But if it doesn't succeed, then we have few different options of how to supplement their testosterone. We have testosterone bioidentical that can apply as a cream, a daily cream on the forearms, and that will give you enough testosterone that you want. A smaller percentage of men will decide that they would rather have injections once a week, and that will also get you the testosterone that you want. But we need to understand that we cannot just give it without supervision, okay? And there are a couple of good books to read about, but in essence, we need to make sure that men who take testosterone don't convert to estrogen, because if you convert to estrogen, obviously we have some other issues, so we need to prevent that if that's an issue. But also it all increases the production of red blood cells. So you have to be aware that if it rises above a certain point, you probably have to become a good friend of the Red Cross and donate blood, and that will take care of that problem.
So is this problem with the red blood cells in the injectables or in the cream, or both?
Oh, it's both. And again, it's not a bad thing, because it just stimulates the bone marrow to make more red blood cells, which if it's within normal range, it's great, because you have a higher capacity of carrying oxygen. It's only if the cell component in the blood volume gets to more than 50%, the blood gets a little sluggish, and more work on the heart to do that. So at that point, we just give a pint of blood, maybe 6 months or a year. But that's a small percentage, maybe just 20%. So most men do not have any side effects.
What about stem cells for the problem?
That's a great question. I really don't, there's not enough data on that, but stem cell, according to our research and according to the literature, definitely, in my opinion, as a holistic physician, slows down the aging process, and I believe they affect just all systems. So I can't tell you for sure that I did stem cell for one of my patients, and voila, I mean, they just know. But knowing what stem cell can do, it's definitely a good option, in my opinion.
There's so much we can talk about, and you can talk about it with Dr. Moshe Dekel and Dr. Bradley Morris at Rejuvenate Health. We have a podcast right here every week. You can explore the topics because we want to rejuvenate your health.